everyone. My name is Samannaaz Khoja, and I am an assistant professor at the University of Pittsburgh, and I'm also a LeaRRn scholar. I appreciate the opportunity to discuss my work with you today as a learning health system scholar with Intermountain Health. And the applied learning case that I will be discussing today is about developing research questions to support the implementation of a falls risk assessment process in the emergency department. I would like to acknowledge my collaborators and health system mentors that have been a part of my journey as a scholar. So Kevin Christensen, Stephen Hunter, and Kate Minnick. I would also like to acknowledge my project and LeaRRn mentor, Dr. Christine McDonough. She has been a pillar of support for me for these past 4 years that I've been a part of LeaRRn, and I am so grateful to have had the opportunity to work with her and to have learned from her wisdom. Okay, I would also like to acknowledge our wonderful team at Intermountain Health. We had a multidisciplinary group of individuals that worked in this quality improvement project, and they're all from different departments at Intermountain. Here are my disclosures and funding slide. And so the domain of the applied learning case today will be on research questions and standards of scientific evidence. And so we will go over, I will try to touch upon these different competencies as we go through the presentation. So here are our learning objectives. So for this applied case, I will be describing experiences engaging with the health system partner to learn about their priorities. I will describe the process of prioritizing and developing a research question that directly addressed one of their priorities. And then I'll also go over the impact of the research question and how that addressed the health system's needs. And then I will also be providing resources related to developing relevant implementation science research questions. Here is a timeline of my engagement with Intermountain. So I started with Intermountain as an external scholar in 2021. And during the first quarter of my engagement with them, I had several meetings with leadership and different Intermountain committee members, and I reviewed documents that were related to Intermountain's operational framework, just to gain an understanding about the health system, its framework, its culture, and how they operate. And then over the next couple quarters, the next 2 quarters, as a scholar, we did identify a work group that I would be collaborating and engaged with. And so I spent some time getting to know their team members, understanding their mission, current priorities. And then starting in the fourth quarter, that was when I actively started collaborating on a quality improvement project, which is related to falls risk screening in the ED. And I helped them drafting the proposal. And then in the sixth, seventh, and eighth quarter, this is when we started working on prioritizing and developing research questions to support that QI process. So the very first step to identifying an appropriate learning health system research question is to understand their priorities. At least that was my experience. And so I just like to give a quick overview of Intermountain. And so Intermountain is really positioned as a very innovative learning health system. They use a combination of the most updated evidence. They also use data to help make decisions about their healthcare delivery and their healthcare processes. Here they incorporate key features of continuous improvement, and you can see in the two figures over there. So the figure on the left is just their operating model. And then the figure on the right is some key features of continuous improvement, right? So they have goals towards standardizing and reducing variation in practice. They're focused on eliminating waste and then improving the flow of their processes. And so as a learning health system scholar with Intermountain, I ended up being matched with their rehab services telehealth work group. And the mission of this work group was to provide evidence-based, accessible, and cost-effective telehealth services to the patients that they served. Right, so some examples of key issues or tasks that they would handle include enhancing access to rehab services using telehealth technologies and platforms. They also addressed maybe billing and regulatory issues and documentation practices. And then this group is also in charge of developing best practices for remote patient monitoring. And they also work with different disciplines in the Intermountain Healthcare system. And the lead for this work group uh, is Kevin Christensen and Dr. Rhonda Taubin. When I started attending the telehealth rehabs work group meetings, they met on a weekly basis. Their current priority was to improve falls risk screening, management, and prevention in patients served by the Intermountain Health System. And their long-term vision was to have a system-wide standardized approach to screening and managing falls risk. So this group meets weekly and they have several initiatives and projects happening concurrently. And as a scholar, I was mostly involved in the quality improvement project related to falls risk assessment in the emergency department. So they were collaborating with emergency department partners and leadership to facilitate falls risk screening and prevention in the ED. And they did this via a formal quality improvement initiative. So there was a proposal, and I helped with the drafting of the proposal. It goes through an approval process, and then we're allowed to get started. At the same time, they were also collaborating with the Office of Wellness Promotion and the Fall Steering Committee to identify other ways to improve falls risk screening in outpatient care and in primary care. And they're also collaborating with the various different technology vendors to assist with remote monitoring or capturing of objective fall-based assessments, such as timed up and go or the chair stand test, etc. So just to give a quick overview, the project that I was involved in the ED consisted of having triage questions that were based on two validated falls risk tools, one of which is the CDC's STEADY algorithm, and the other is the Memorial ED falls risk assessment tool. And then they also have a bedside mobility assessment that nurses would complete if a patient was positive for falls risk based on how they answered the triage questions. And then the last part of that falls risk screening in the ED was to have, as part of discharge planning, use of a standardized road test, which is just a test to see can a patient walk safely and be discharged home. And the goal was to try and use a performance-based test such as timed up and go to do that as opposed to just subjectively watching the patient walk. So I won't go into too many details about the quality improvement project as such and its planning and components, but I will focus more on the process of identifying, prioritizing, and developing research questions that addressed their health system priority, which was falls risk assessment in the emergency department. So the first step in identifying research questions, right? We started as just having organic discussions related to the falls risk quality improvement initiative. So the process of identifying was a process of discovery, and it was iterative, very organic. We spent a lot of time during our weekly meetings trying to understand what were the main important questions that our stakeholders had about the quality improvement initiative, right? So it was a circular process. It began with organic discussions. And then from these discussions, I would list and categorize questions based on theme. I would try to see if there are themes. And then we did do an evidence review for each of those questions. And then once I did the evidence review, I brought my findings back to the group for discussion. And then this is how we went through the process of narrowing down and prioritizing our questions. Here are some of the main questions that were raised by the team with respect to the falls risk screening project, right? So there were questions about what are some valid and appropriate screening tools for the ED? How accurate are performance-based tests in predicting falls risk, and which tests should we use or can we use? How will workflow be affected by including a falls risk assessment in the ED? And how do we measure whether our quality improvement initiative is successful or not in the ED? And then what are some appropriate interventions or care pathways to manage those who are identified as being at falls risk while they're in the ED? So these were some of the questions that were raised. And then if we categorize them into um, certain themes, we can see that there were questions around screening tool selection and psychometric properties, right? So what are the valid and appropriate falls screening tools? How accurate are performance-based tests? Right? There were questions around implementation and evaluating outcomes of the quality improvement initiative, right? So they had questions about workflow, success. They had questions about whether providers would do this, would uptake be successful. They also had questions on whether it would be beneficial to the patient. And then in terms of the last theme was intervention selection, right? So what are some appropriate interventions or care pathways once someone has been identified as a falls risk, right? How would we plan for the discharge? You know, what kind of interventions can be used easily in the ED? So those were the questions and their broad themes. And then the next step was doing an evidence review for each of these broad question themes. So I will just review some key points and some key takeaways from the literature review that I did. So in terms of falls risk screening tools and the selection. So a quick review of the evidence showed there's lack of consensus on appropriate and feasible screening tools for the ED. There have been several different tools, mostly questionnaires, that have been developed and tested, but the validity and predictability was limited in most cases, and there were mixed results. And more recent ED research, there are studies that have incorporated the CDC's STEADY algorithm. And there are some ED studies that have also looked at using objective tests, such as the timed up and go. And these studies have also demonstrated mixed results in terms of predicting future fall risk and even just implementation in the ED. So if you're not aware, the CDC STEADY algorithm, this is a tool to screen for falls risk and to address risk factors for fall. They do have a questionnaire. There's a long form and the short form. And this is mostly for community dwelling adults. However, there have been some studies that are testing it to see if it can be used in the ED. There's another falls risk assessment tool that has been more recently developed and showed fairly good accuracy with sensitivity and specificity of greater than 90%. This is the Memorial ED Falls Risk Assessment tool. Then for the theme of implementation and evaluation of outcomes, right? So over the past several years, assessing falls risk in the ED is something that has been strongly recommended by various professional associations, including emergency medicine and geriatric medicine professional. And this is largely driven by just the growing numbers of elderly individuals, those above 65, coming into the ED. Most of them are coming into the ED because of a ground level fall. And so there's been this increasing advocacy, behind improving the care in the ED for geriatric patients. Right, so there is a lot of impetus behind this move. There's a movement for having EDs that specialize in geriatrics, right? And so there has been an interest in managing falls risk in the ED. However, the literature shows that the implementation and sustainment of falls risk in the ED has not been successful on a large scale. And there have been several reported barriers, including time constraints, competing priorities, lack of training on falls risk assessment, difficulties in incorporating it due to workflow structure, and then also inadequate and inequitable access to appropriate referral pathways for those that do have a falls risk and need further management. And then the last theme with respect to interventions for managing falls risk in the ED, most of these interventions have been studied in the context of a clinical and pragmatic trial. And these interventions range from revising staff structure and roles or providing specialized training. So having nurse liaisons that are trained in geriatrics, having a multidisciplinary falls team, so having PTs or OTs in the ED, having a pharmacist, having case managers. And then some of the interventions also looked at modifying workflows and providing appropriate referrals and best practice alerts when someone is identified as being at risk of falls. So to summarize, there have been different falls risk screening tools that have been tested in the ED, and they've shown mixed results. Some tools have shown very good preliminary accuracy, while others, are less accurate and less valid for the ED. Most interventions that have been tested have done so in the context of a randomized clinical trial or pragmatic trial. And implementation efforts to incorporate falls risk screening in the ED has not been widely successful. And further, there is limited data on the downstream benefits of falls risk screening to patients and to the healthcare systems. Right? So what did we do with all of that information? Right? So we continued this discussion of the evidence and to try and narrow down our question. So we had several discussions to decide which research question would be most responsive to the current priority, which was the quality improvement initiative. And evidence on screening tools, the group decided that that evidence was adequate. They felt comfortable using an existing screening tool, and they actually modified the their screening tools. So what ended up happening is they chose to use some of the triage questions from the CDC study algorithm, and then they also incorporate an assessment of cognition, which is part of the Memorial ED risk assessment tool. So the group did not think it was necessary to pursue a question related to screening tool selection. With respect to interventions, the group felt that they were not ready to explore the effect of different falls risk interventions or referral pathways, as that was still in the preliminary stages of deciding, what would be feasible, what would be most appropriate in their health system. So based on group consensus, the most impactful research question for the health system would be the one that directly addressed the implementation of the falls risk assessment in the ED. So in addition to choosing a question that directly complemented the quality improvement project, we also had to prioritize a research question based on certain practical aspects. So it needed to be a question that could provide meaningful information to the health system in a timely fashion. And it needed to be a question that could be answered, feasibly, and that would not delay the quality improvement efforts. Right. So once we narrowed down our question theme, which was we were going to pursue a question looking at the implementation of our falls risk screening, then the next step would be to use implementation science frameworks to further develop and finalize our questions, and then also to inform our study methods. So I have here the two implementation science frameworks that were in consideration once we decided our question theme. So I have the consolidated framework for implementation research and the LeaRRn framework. So our health system's priority was to understand how this QI initiative would be received by their frontline ED clinicians and providers. And they also wanted to understand what barriers and challenges they may face while implementing the falls risk screening. And so, if we look at this question, it really aligns with questions that look at the determinants of implementation, right? So, what our health system was interested in was understanding acceptability, feasibility, workflow barriers, and then also addressing, provider buy-in and maybe additional resources that they need to successfully implement the falls risk screening. So we took that question and we mapped it to our CFR framework. And I do just want to make one disclaimer that we use the original CFR framework 1.0. CFR has, since this project, it has been updated to CFR 2.0, and that looks a little bit different. So I just wanted to point that out, that we were operating with the original CFR framework. Then the other question that they were interested in was evaluating and understanding how to evaluate the outcomes of this QI initiative, right? So how would we know if this quality improvement initiative was successful and if we should continue to support it, right? So they were interested in whether are we screening the intended population, are providers doing the screening? So is there adoption of the screening by the providers? And then another long-term question is the effectiveness. So how does falls risk screening benefit the patients? How does it benefit the health system? And so that question seemed to align more with the LeaRRn framework, which is typically used to evaluate outcomes. So if we took our first question, and here I just have divided it into two sub-questions of, is falls risk assessment perceived as valuable, acceptable, and feasible by the ED providers? And then what are the barriers and enablers to implementing the falls risk assessment, right? So we map this to different domains on the CFR framework, right? To just further develop the question and inform our methods, right? So these two questions, we were essentially interested in understanding provider characteristics, right? Their ability, their knowledge, their beliefs, their ability to conduct the falls risk screening and apply appropriate falls risk precautions. We also wanted to understand their perception of the intervention. Was it complex? We wanted to understand, if it needs to be adapted. And then we also wanted to understand the implementation climate, right? Are they able to implement it? Are there other competing priorities? And so we mapped that, our first questions to the CFR. And then looking at the second question, which was about evaluating the success of the quality improvement project, we mapped that to the VA, right? So it had three components. We're looking at reach. So who will be identified and prioritized for screening? Will we be able to screen all individuals who do need falls risk assessment? So are we identifying and prioritizing the correct population? And then we also have questions about adoption, right? So are providers going to regularly conduct falls risk assessment as part of the workflow in the intended population? And then for effectiveness, we were interested in understanding, will regular falls risk assessment reduce the number of accidental falls in the ED? Will it also reduce admissions and readmissions due to fall-related injuries, right? So those were some of the long-term questions that they had. So after developing the questions, using implementation science to anchor these questions and finalize them, and also to inform our methods, this is what we came up with. These were our final, and I'll present them as research aims, right? So the first aim would be to assess the acceptability, feasibility, and barriers and facilitators to implementing the proposed falls risk assessment in the ED. The second aim was to develop a formative evaluation plan to assess the implementation of the falls risk quality improvement initiative. And so this question is anchored to our re-aim framework. So we would be exploring, selecting outcomes for reach, adoption, and effectiveness. And then we did add a third question in there related to identifying high-risk groups that should be prioritized for risk assessment. And this last study aim or research aim was added because we wanted to be responsive to the health system's concerns with reaching the intended population, and also in trying to identify whom the falls risk screening should be catered to. Okay, so the ED is a very busy environment, and the way the current quality improvement initiative is set up, the falls risk screening is triggered in their triage for all adults above 65 years of age. And this criteria might be too broad, and because there's a large number of older adults coming to the ED, there is a thought that maybe the number of falls risk assessments that will need to be done in the ED would become too much, and there's a concern that falls risk screening may not be prioritized because they have to do it in too many people, and and a lot of these individuals may not need to undergo falls risk assessment in the ED, right? So this was just to be responsive to the health system's concerns with whom we need to prioritize falls risk screening. So a little bit about the value of these research questions and aims, right? So the selected research questions will provide meaningful feedback to the health system regarding their ongoing quality improvement initiative. So that's number one. It was directly related to supporting their QI initiative and giving them information about the implementation of their QI initiative, right? And so the data we would collect from these research questions and study would be, we would inform the health system about how feasible this is. Are providers doing it? Are there more resources needed? Are there necessary modifications needed to ensure the success of the quality improvement initiative, right? So the questions we selected is directly assessing the feasibility and acceptability of their QI initiative. And then I'll talk a little bit about some of the successes or the impact of these research questions. So we did engage with the health system to understand their priorities. And we used implementation science principles and framework to help support a quality improvement process. So I think that's the biggest benefit of doing this research in conjunction with the QI process, right? And these research questions were developed considering the evidence, considering the health system's priority, and we also consider the practicality of it being answered within a feasible timeframe and without disrupting their ongoing efforts. So since the development of these questions, we did develop and submit a research proposal, which did get funded. And the pilot study is underway, and we're currently recruiting ED providers to participate in semi-structured interviews, asking them about the implementation of the falls risk screening process in the ED. And we are using rapid qualitative analysis methods to provide timely feedback from the interviewees to the health system leaders. So we've been able to do that a couple of times, and a lot of the feedback received from the ED providers is going back to leadership, and there have already been certain changes being made to how the falls risk screening process is set up in the ED. So this research project created a feedback loop to keep the health system partners engaged, right, with the implementation of the Falls Risk Quality Improvement Initiative, right? And they're using the constructive feedback from their frontline ED providers, right? So this study is happening against the backdrop of continued quality improvement efforts by the telehealth work group and the ED work group and other work groups, right? So in addition to this research study and the QI initiative, they are also currently working on developing appropriate fall discharge plans for those at falls risk, and they're also trying to work on referral pathways. They've integrated the screening tools into the EMR, right? And they've conducted trainings for ED providers who are doing these falls risk assessments. And they've also created some data dashboards that are not widely available yet, but they're trying to look at the uptake of the falls risk questions in triage. So whether providers are asking patients the triage questions, and then they're also looking at how often the bedside mobility assessment test is being done. And then they're also looking to see if there is any uptake of the timed up and go test as part of the standardized road test prior to discharging a patient to home. So there's a lot of activities going on. And then the research project is just one of the activities to support incorporating falls risk screening in the ED. So there were a lot of challenges during the process of, developing the research questions and the research study. So there are several moving targets and priorities that needed to be considered. The ED has competing priorities. Currently, the health system is undergoing changes in their electronic medical record system. So we've had a lot of periods where there's been a lot of activity. And a lot of impetus behind the falls risk screening process in the ED. Other times it's been slow. And the quality improvement initiative has undergone different iterations, and it's really important to be agile with respect to prioritizing research questions. So because the health system moves at a very different pace than a research study conducted in an academic setting, we had to really be considerate about the type of research question that we selected. So we had to go with not just prioritizing their current needs, but also with something that was practical and didn't disrupt their operations, right? So this was a slow iterative process. The development and finalizing of questions, I would say it took several months, right? And we had setbacks and different competing priorities. So the group would not meet with respect to this quality improvement initiative when they had other priorities to address. So just to bring it all together, so if we think about the competencies this learning case addressed, right? So we talked about engaging with stakeholders and how we identified and prioritized research questions and how that process played out. So in our case, it was just a lot of organic discussions, iterative feedback, looking at the evidence, right? So we assess the scientific evidence to address gaps, identify important research questions. We also assess the evidence to determine its applicability to the care setting, right? And then we went through the process of composing research questions that addressed meaningful issues for the health systems and ones that can also be realistically addressed within the health system. So those were the competencies that were addressed in this domain. I do have references for you that you can look up. Additionally, we will be posting a curated list of resources that should be helpful when you think of how to prioritize and decide on a research question that's addressing a health system's needs. There's also some papers about how to engage with different stakeholders and health system partners. Anyways, thank you for listening. I hope you found this learning case helpful, and I have my email and team's phone number if you would like to reach out with questions. Thank you.